Good evening, everyone. This is Dr. Jen Kordonsky from Optimal Spine Chiropractic in Aberdeen, Maryland. And tonight's workshop is Relieve Pain Naturally. Pain is something that we've all dealt with, we're all going to deal with. You may know people who should be listening to this class, and I definitely want you to refer them to the link on YouTube or here on Facebook so that they can listen to this information. But tonight we're going to go over two common types of pain scenarios, two common pain conditions, and a three-step approach to relieve that pain, get out of that pain naturally. And I definitely want you to grab a paper and a pen because there's going to be a couple of notes that are going to be relevant to you or to someone you know that you might want to jot down. But before we dig in, I want to share with you a story. Dr. Mark and I opened this practice back in 2006, and early on we had a wonderful patient who we took care of. She was a lovely, lovely woman. She came in for low back pain was her primary concern. And we did x-rays. We used to do the x-rays right here in the office, and we found there was some degeneration, damage to the discs in her lower back. And we gave her a plan of care, and as lovely as a person as she was, she did not stick to the plan that we recommended to her. She was a little bit sporadic in her care here and there, and then kind of fell off track and then got back on track, and then we lost track of her. And many years went by, and she came back in many years later, and she was in a pretty dire situation. She was in very acute, intense low back pain, radiating down her legs, difficulty walking. And it turns out that years prior, after she kind of dabbled in chiropractic care, she went to a surgeon, and what they did was, because of the damaged area in her lumbar spine, they did a fusion, and they fused L5 to sacrum, the tailbone, or the base of the spine here. They fused that because that area was getting damaged, it was unstable, so they just took care of that problem. She had relief of her symptoms, and she was doing well for many years, or a few years after that, and then trouble started to arise again. And when she came back to us, so this is a few years post-surgery, and now what was happening is that same damage and decay that was breaking down that L5-S1 junction was now occurring at L4, L5, one step above. So it was right above. The point of the story is that the surgery, although it relieved her pain and symptoms, and it may have been a lot simpler and easier than the work that we were recommending and that we were, the course of care that we were putting her through, it did not correct the cause of the breakdown, right? The damage continued even while she was feeling pain because the root cause was the shape and alignment of her spine. So many people get told, you have disc deterioration, you have arthritis, you have fill in the blank condition, and that is what's causing the pain that you're experiencing. That is the cause. Well, we have to go one step back and say, well, what caused the disc to become deteriorated? What caused the bulge? What caused the arthritis? That is almost always a symptom of the problem. And especially when we're talking about these musculoskeletal conditions, the body's alignment and mechanics are almost always one of the underlying root causes of the damage unfolding. So in her case, we weren't able to repair the area that had already been surgically repaired, but she was able to then say, okay, I'm going to work through the corrective plan and not just get out of pain this time, but actually fix the problem and prevent the next surgery from being necessary. But most people aren't told this information. They're not told that the surgery isn't going to correct the root cause of the problem. And there's a really important moral to this story too, is that feeling good, no matter how you got to feeling good, if you had zero pain ever and you feel great, or you had pain and you got out of it, whether it was through adjustments, through injections, through meditation, whatever it was, just because the pain went away, this does not mean, we cannot take that to mean, oh, I'm healthy, I'm well. No pain doesn't equal no problems or that the problem has been fixed. That's an important, valuable lesson. We have to look a little deeper than how we feel on the surface. And the other moral of the story is that taking care of your spine is a lifetime responsibility. Just like taking care of your teeth. You wouldn't just brush or just see the dentist when you have pain. You go throughout a lifetime. And hopefully you catch and prevent big problems by dealing with the little things preventatively. So caring for your spine is a lifetime responsibility, especially once there's been damage and once pain shows up. Treating pain without addressing the cause of the pain is exactly like your smoke detector going off in the house and you just going and pulling the batteries out of it. Sure, it stops the alarm, and it makes that annoying sound go away and you can get back to what you were doing. But why was the smoke detector going off? Is there a fire somewhere in the house? Do we need to know about this? The other analogy that I like to use is if you're driving down the road and your check engine light comes on your dashboard. Well, one way to deal with that is to just, put a tissue over it, put a picture of your kids over it, Post-it note. There's a lot of ways that you can get rid of that problem, right? I don't have to look at that check engine light anymore. Everything must be fine. That's what dealing with pain is like without addressing the underlying cause. It makes no sense in those scenarios. Smart people like you would never do that. But we've been kind of trained to treat our bodies with less respect and less care and less attention than we give our cars. So tonight, like I said, we're going to cover a 3-step approach to treating pain naturally, relieving pain. And the 3-step approach is key. The order is key. I want to point out that I'm going to be sharing things with you tonight that you may have tried already and they didn't work. But the order is essential. If you were baking cupcakes, you wouldn't ice the cupcakes before you baked them, right? The end result would not be what you were after. The order is imperative. So tonight's 2 categories of pain that we're going to kind of separate and look at slightly individually, but in the same vein, is we have a lot of people who deal with headaches, and people tell us all the time, oh, well, they're just normal headaches. Everybody gets headaches. It's not normal. It may be common, but it's not necessarily normal. So we're going to categorize headaches as one type of pain, and then we're going to take the other types of musculoskeletal pain that we feel in our body, and we're going to put that in another category. So this is going to include joint pain of all kinds, back pain, neck pain, muscular pain, even nerve pain, even in the case of a diagnosis being issued, such as arthritis of XYZ joint, or degenerative disc disease, or disc herniation. Regardless of the diagnosis, we're going to look at headaches and then musculoskeletal arthritic joint pain on the other hand. So step 1 in all of this is looking for the cause of the pain and asking yourself, what really is causing this? And I will guarantee you it is not likely to be a deficiency of Tylenol or ibuprofen in your body, right? There's not a deficiency of steroids. But that's kind of our reflexive approach in the healthcare model that we live in. If you were to go to a medical doctor with pain of any of these sorts, or you're just a caring person whose friend says, hey, I have a headache, our reflexive response is almost always, did you take something? Would you like something? Because this is the way we've been conditioned. I want you to stop and ask yourself, ask your body, why? What's going on here? Subluxations are almost always one of the root causes, the underlying contributing factor to so many different symptoms in the body, but especially pain in the body, headaches and other joint pain. Why is that? Is that just because I'm a chiropractor and that's the way I see the world? Well, how many parts of your body are supplied by the nerves that exit the spinal column? Absolutely all of them. right? There's no part of your body that doesn't rely on neurological information and communication with the brain through the spinal cord. I always say there's some of the facial nerves that come right through the skull, but almost every nerve in your body has to pass through the spinal cord. So how does the alignment of the spine, the joint mechanics of the spine, not affect how every part of your body functions? When we look at subluxations directly causing headaches, there's a lot of different pathways that a subluxation can be the root cause of headaches. You know, subluxations in the cervical spine can create tension and irritation in the muscles, triggering occipital headaches, tension headaches. It can change the blood flow through the muscles to the brain and trigger a headache that way, subluxations in the neck. We can have subluxations in the middle part of the spine, the thoracic part of the spine, that affect the respiratory system. So decreased oxygenation of the blood can trigger a headache. We can have subluxations of the thoracic spine that are affecting the adrenal glands and the stress response. We can have subluxations of the lumbopelvic area that are creating problems in the reproductive organs, so hormonal issues that can contribute to headaches. We can have subluxations that are impacting the digestive system, and when we have less than optimal digestion, well, we can have key nutrients that we're not absorbing well. We can have difficulty eliminating toxins from our body, or slower elimination of toxins. So headaches being caused by subluxations is extremely common, and it's always has to be the very first thing we look to. Remember the cupcakes with the icing before they're baked? Doesn't work. So you may have tried medications and supplements and all different techniques, and if there are subluxations preventing your body from working optimally, then all of those things, as wonderful as they might be and as important as they might be, won't be maximally effective. So the root cause of subluxations has to be looked at first. Now, subluxations causing other musculoskeletal, joint, nerve, muscle pain, that's a no-brainer. The mechanics of the body, the alignment of the body is crucial for how it works. Now, I can't stress this enough. Many times people are told, oh, you have arthritis. Oh, you have a disc bulge. This is why. And I've been told over by patients, oh, I know why I have the problem, because I have arthritis. Well, what caused the arthritis? And especially in the case of osteoarthritis, abnormal joint mechanics are almost always the culprit, right? Whether there was an injury in the past that changed the way the joint aligns and moves, damaged the joint capsule, and now changes the joint surfaces, or if it was just years of cumulative use and abuse of our body, all normal things that we all go through, joint mechanics and alignment of the body are almost always to blame for arthritis developing. So if we can bring the body back into alignment, then even if the joint has damage, even if there is arthritis there, you may not feel the effects of it anymore. And you can certainly potentially stop it from progressing, and your body knows how to heal. It's constantly trying to do the best it can by you. And if you understand how arthritis forms, it's actually your body working to protect you. It's doing the best by you. And if you have a question about that, I'll explain it. But I want to get to some of the other contributing factors here. So step one is addressing the subluxations. Step two are the secondary factors. Now, a lot of people spend a lot of time in the secondary and tertiary factors, and they get lost here. The importance of the order cannot be stressed enough. Like I said, you may have tried some of these things. They may seem overly simplistic to you. You may also start to think, well, if that's a contributing factor, well, so is this, and this. And you can get overwhelmed in all the things that might be causing this symptom in my body, whether it's the weather or whatever it is. The key here is that the things that I'm about to share with you, the secondary factors that you have to address if you want to relieve your pain, I've already run through the vital needs pyramid. And I'm not going to take too much time to explain the whole thing to you because I want to get to the meat and potatoes here. But the pyramid of vital needs are the 4 things that your body absolutely requires to maintain itself in existence, to be alive. And without these 4 things, you die. So we have nerve supply, we have oxygen, we have water, and we have nutrients. So if you stopped receiving or you blocked any one of these things from moving through or into your body, you know you won't live. So they're vital needs. Doesn't it make sense that if something is absolutely critical for your survival, that the quality with which you attend to that need is going to make an impression upon the quality of your life? I absolutely firmly believe that we have to look to those vital needs first before we start dabbling in anything above and beyond them. So do not feel like these are simplistic. They're crucial. And if these elements aren't being addressed, just like the subluxation, anything else we do won't be effective. It's like trying to fill a bucket that has a hole in it if you're missing one of these key things. So when we're dealing with headaches, one of the secondary factors that needs to be addressed is hydration. And you can imagine, I'm sure you've experienced, that if you get dehydrated, that can trigger a headache. Your body is doing what it can to protect you by dilating the blood vessels to the brain to try to get more blood flow to the brain. It does this when we're low in oxygen or slightly or even maximally dehydrated. So the hydration status of your body, you may not have, gone days without water, but if it's borderline and you're not optimally hydrated, that can be a huge contributing factor. A lot of people don't feel thirsty because they're drinking things all day, but they might be things like coffee or tea or sodas that are actually dehydrating more than they are hydrating that individual. So optimal hydration is a key element. Your body is intelligent. It knows how much water you need. There is no scientist who knows. It's never been proven that, this many ounces of water. Everyone has their theory. The most important thing to know is that your body will output excess water that you don't need, and it'll hold on when you are low in water. So we want to go for pale to clear urine, and that's your indicator that you're hydrating your tissues properly. Number 2, when we're dealing with headaches, is that oxygenation and blood flow. So remember how I said your body will dilate or make wider the blood vessels to the brain, which can trigger a headache if we have lower than optimal oxygen levels or the blood flow is not ideal. So that can be caused by two major or real obvious things that need to be addressed immediately. If you are too sedentary and your body doesn't get moving often enough and the blood flow is diminished, that can be a trigger. So exercise, movement is a vital part of dealing with headaches. And even mild to moderate, short movement sessions sporadically through the day can be majorly helpful in dealing with especially chronic headaches. The other part is postural. So it's with the oxygen and it's also creating muscle tension. So many of us sit at computers to do our work. We're looking down at phones very often. So this forward head posture or this kind of position of being in front of a computer and your head coming forward of where it belongs, that creates a huge postural stress that's felt primarily by the muscles that hold your head up. Right? So we want those muscles to be relaxed and at ease by having good posture. And when they're stressed like this, they start to get tense and tight, and that can trigger a headache very easily. You would be amazed if you counted how many times a day you look down at something and your chin is coming down and that forward head posture. So if you can decrease the number of times, fantastic. Every little bit helps. And I know that you're doing it because I see people here sitting waiting for their adjustments, looking down at their phones, and I catch myself doing it. So we're all guilty of this. We all have to pay attention and do a little bit better posturally so that we're not triggering that headache. And again, you might be thinking, oh, it's not that big of a deal. These are fundamental things. If we put them in the right order and we eliminate the holes in the bucket, then your body is almost guaranteed to start improving the way it functions. And as its function improves, then symptoms improve. And if we've covered the holes in the bucket and the symptom is still there, then and only then do we go looking for other things that might be a contributing factor or other solutions to the problem. We can't try to apply solutions until we fix the fundamentals. So lastly, as far as headaches go, and I'm going to touch on this, but it's a big topic. Unstable blood sugar levels are very commonly a trigger for headaches. And unstable blood sugar levels could come from someone either not eating often enough and their blood sugar drops, or what happens more often than that is that the quality of the meals aren't ideal. And so what happens is if we eat something that's very processed or high in sugar, refined carbohydrates, we get our blood sugar goes up and then will drop pretty rapidly. And that fluctuation in the blood sugar can trigger the headache. So like I said, this is a huge topic, and if you need more help addressing this one, please let me know. I'm here for you. But ideally, we'd like to make sure that the quality of the meals and the snacks that you consume through the day are better, not so processed, not so refined. Think fiber, think protein, think healthy fats. If you have a snack that's just pure carbohydrate, even if it's something healthy, like an apple, that's better than other things because it does naturally have fiber in it, but it doesn't have protein or healthy fats in it, so it's digested quickly. It's going to be a rise in blood sugar and then a drop in blood sugar. When we have fiber, healthy fat, and protein in a snack, then we get a slower rise in blood sugar and a slower drop in blood sugar. And your body handles that ride a whole lot better than the quick up and down. The other thing that some people are doing is never taking a break in the day. They're just constantly nibbling or constantly sipping, and there's sugar coming in all the time. So your body gets very conditioned to relying on that incoming sugar. And if you don't get that snack, you don't get that blood sugar rise, then your body is like, hey, this isn't right, and instantly a headache can be triggered, or other symptoms. What we want to do is have good quality meals, quality snacks that are spaced apart, however long your body tolerates, but not a constant snacking through the day, because when there's a space between the meals, because you've had enough to satiate you for a couple of hours, then your body, when the blood sugar starts to go low, because it went down slowly, your body says, okay, I know what to do. And it starts pulling from your fat stores to bring the blood sugar back up. So stabilizing blood sugar is important. That might be just skimming the surface. So if you need more help, let me know. Now, secondary factors for other musculoskeletal pain besides headaches. We've got to look at hydration again. Joint fluid is fluid, right? If we are even mildly dehydrated, our discs are not going to be as cushiony. The fluid in all of our joint capsules won't be as lubricating to the joint. So hydration is very important. Please do not ignore that. And then the movement factor. And there's a vicious cycle at play here, because when we have pain in our body, we tend not to want to move it, right? And the less we move, the more that's going to allow the joints to decay and deteriorate, and the pain can get worse, and we're in this vicious cycle. Now, I want to reiterate that it's absolutely critical to address the subluxations first, because if the pain in a joint or the pain in moving your body is coming from altered biomechanics, your body's not in proper alignment, and you exercise through that pain, even if you have no pain and you exercise on a body out of alignment, this is going to accelerate the wear and tear to the joints and create more damage and decay. So we don't want to exercise on a body that's out of alignment. And we do have to be respectful of the fact that, pain is telling you something, but movement is critical. And a joint that never goes through a full range of motion is not going to be maximally healthy. And I tell people, think of like a rusty door hinge, right? If we get in there and we open and close the door all the time after it's aligned properly, and we oil the hinge and we open it and close it and open and close it and oil it, well, then it's going to start to smooth out and it's going to start to work better, right? And it's going to stop rusting shut. But if we close and lock that door and we don't open and close it, when we come back a few years later, it might be rusted shut. And your joints are the same way. Movement is critical. So make sure that you break up your sedentary periods with some gentle movement. Exercise is key, but done on a healthy, aligned body. And third, we're going to hit diet again, and which is a huge topic. But when it comes to joint pain, arthritis, any other musculoskeletal pain, taking in foods that are inflammatory is always going to make the pain worse. So, what are inflammatory foods? Well, you can do a Google search, right? But in general, the white flour, white sugar, refined processed foods, and the unhealthy oils. So I mentioned before that we want to have healthy fats in our meals. So that's things like raw nuts and seeds, olives, avocado, coconut, or the oil made from those things, avocado oil, coconut oil, and olive oil. And the unhealthy fats are basically in everything that you could buy at the grocery store. It's like there's a plot against us. But if you look at labels and you see cottonseed oil, canola oil, vegetable oil, all of these refined oils are extremely inflammatory. They irritate your body and they'll make any pain condition worse. So you can have a joint that is totally arthritic, but you can get inflammation lower in your body and not feel pain. Or you can have a little bit of arthritis and the inflammation levels go up in your body and you could feel tons of pain from a smaller problem. So lowering inflammation is key, and getting those inflammatory, provoking things out of the diet is really, really helpful. But again, put in the proper order. You may have made changes to your diet before and felt like, oh, it didn't really help. I'm still dealing with it. But had you addressed the subluxations first? Had you addressed the hydration? Have you addressed the movement? Are you putting the pieces together in the right order? So, step 3 is, and you have to, I know I've said it a couple of times, but don't put the cart before the horse on this one. It's so tempting to jump to step 3 because we all want, I'm guilty of it myself, I just want the easy way out. I want the pill, I want the solution, the magic in a bottle that's going to make everything go away. And it just doesn't work like that. But step 3 is about, once we've addressed all those other factors, giving ourselves the supplements or the little extra something on top that can help us handle or help us recover from those issues. So when it comes to headaches, there is a big correlation. I think it's about 30% of chronic headache sufferers they find are low in magnesium, a simple nutrient that is in pretty much any multivitamin, magnesium. Now, birth control, diuretics, any acid-lowering medications will automatically steal magnesium from your body, and our foods are becoming more and more depleted in magnesium. So the things that used to be high in magnesium are dark leafy greens and things like that are getting lower than they used to be. And let's face the facts, are we all eating as many dark leafy greens as we should? So magnesium is something that you might consider supplementing with. You want to look and see how much magnesium you're getting in your diet, because the average adult should have about 300 to 400 milligrams of magnesium a day. So if you eat a high magnesium diet, then this may not be something you need to supplement with. But the majority of people can do with a little extra magnesium, so take a look. The next is vitamin D. Vitamin D has been shown to be deficient in 50% of chronic migraine sufferers. Vitamin D has a lot of actions in your body. Most importantly, in my opinion, especially in the times that we're in, is its impact on your immune system. So optimizing your vitamin D levels, really important across the board for everyone. Thank God it's summer now, the sun is out, we can get some natural vitamin D, but we have to make sure that we're not deficient. So a blood test is in order to find out what your vitamin D levels are, and then find out how much you need to supplement with. Talk to me if you have any particular questions. There's a great website, grassrootshealth.org or .net, grassrootshealth.net. And you can order your own test kit and see how much vitamin D you actually need to supplement with. And the last supplement for headache sufferers would be fish oil or some other type of omega-3 fatty acid supplement. So that gets more of those healthy fats in your body to help balance that. And for the other musculoskeletal conditions, all of them, there are 3 things that I recommend very highly. One is a product that we carry here called OPC3, and it is a blend of resveratrol, pycnogenol, grapeseed extract, and something else. But they're all powerful antioxidants. So that's going to be very helpful for all of your cells, for anti-aging, but it's really helpful in inflammation and pain. So OPC3 is great. And then turmeric, which you've probably heard about, is very powerful anti-inflammatory herb that's very good for your body. And in some cases, glucosamine and chondroitin, if there's been arthritic change to the joint, then in some cases glucosamine and chondroitin has been found to be helpful, and it's worth a try. Unless you're allergic to shellfish, then it's definitely worth a try, especially if we're dealing with arthritis of the knees, hips, things like that. We have a product here that I absolutely love called NutriDisc, and it's a combination of the turmeric and the glucosamine and chondroitin, and it's bioavailable turmeric, which is important that you want to get something very absorbable that your body can actually efficiently use. So that's something, like I said, we have here that I think is fabulous, not just for disc issues, even though it's called NutriDisc. So in conclusion, we've gone over lots of keys here, lots of things that you can tackle. Please put them in the right order. Please let me know when you have questions, and we're here to help you through all of this. And as we close, I just want to tell you a quick story, if you hang in there with me one more minute, because I think it's really important that when we talk about pain, we do not get caught up in the pain. I told you that treating pain without treating the cause, that's like taking the batteries out of your smoke detector. That is not smart. But what if there is no pain? What if we have a situation where I've never had pain, there isn't an issue, do I need to worry about these things? And the story of a little guy that I've taken care of for many years comes to mind, and he was just maybe, I'm going to estimate, like 16 months old. He was a toddler. He was new at walking, and I got a phone call on our cell number that we always leave on the voicemail in case of emergencies. I got a phone call on a Saturday or a Sunday from his mom, and she told me what happened. And the night before, she had, the little guy was playing with his cousins, and in the hubbub of saying goodbye and giving hugs to his cousins when they were leaving, he got knocked over. No big deal. He cried just a little bit and was soothed by mom, and everything seemed fine. And a few hours later, he was put to bed and slept beautifully through the night, no issues. When he woke up the next morning, mom took him out of his crib and put him down, and instead of just running off like he would ordinarily, he took a few steps and stumbled. And mom helped him up, and it was no big deal, and then he stumbled again. And what she realized is that he was not able to walk more than a few steps without stumbling. Something was wrong. And she was very worried, but she, having been under chiropractic care herself for a long time, understood what might be going on. It was possible that he had a subluxation. So I talked to her on the phone. Now, we were also worried that maybe he had a concussion, maybe something else more serious was going on. But I told her, on your way to the urgent care, I want you to stop by and let me take a quick look at him. So I checked him out, and it was very, very obvious that he had a subluxation at C1. And I did a very gentle little adjustment. If you've seen me adjust kids, it's a lot different than the adults' adjustment, especially the little ones. And usually there's no sound involved in a child's adjustment. And I had my finger on his C1 and I was gently guiding it in the right direction, and it went clunk, like a big loud noise, surprised even me. And he smiled and everything else felt fine. So I put him down on the ground and he ran off like nothing had happened. And we were so happy, and Mom and I were smiling and laughing about this little guy. And it struck me later, hours later, that this wasn't a happy story. It was for him, but it really bothered me. I got really bothered by the knowing that if his mom didn't understand chiropractic and do what she did, any good mom would have said, we've got to get to a doctor and have this child checked out and find out what's causing the problem. And knowing that the problem was a subluxation, he would have gone to the hospital or the ER or wherever, and they would not have found a cause to the problem. And they would have, thank God there was nothing else wrong, of course, but he would have spent the next few hours, few days adapting, and his body would have figured out a way to deal with it. And his little sense of equilibrium would have coped, and he would have figured out how to walk normally again. And he was so sensitive to it because he was a new walker. But you may have subluxations and your body's just like, okay, this is just the way it's always been, and I know how to walk well enough that I can cope with this. But he was sensitive, so he showed that issue. And if she didn't know, he would have gotten through the issue. But what if the underlying subluxation was still there and his body just adapted to it, but it was still there, and now he grows with that subluxation? How would that have impacted him through the years? We have no way of knowing. And that's why I want to strongly encourage you to not wait for pain. Be proactive, take care of your spine, your family's spine. Pass this information on to someone that you know. And I thank you so much for your time. Sorry we went a little long tonight, but I will see you all soon.